Hi everyone, I'm Maimah Karmo, your host for Breathe TV. Thanks for being with us today in this space where we're going to be talking about breast cancer and fear of recurrence, family history, and living through this breast cancer journey. Just talking about these topics is so important to overcome the fear and give you that power to move into your journey with more strength, more empowerment, and as your own best advocate. So my guest today is Ashley Dedmon. She's an amazing advocate. She's so powerful, and her story will leave you guys breathless. How are you doing today, Ashley?
I'm doing well. How are you doing?
I am so happy to see you. You look beautiful, and I'm looking forward to hearing your story and what you've been through and having the audience learn about you as well. You are a pre-viver, right?
Yes, I am a pre-viver.
Tell our amazing guests, our amazing listeners, your story because it's really powerful.
I come from 3 generations of women impacted by breast cancer. My great-grandmother, grandmother, and mother were all diagnosed with breast cancer. My mother was diagnosed in 2007 with stage 4 metastatic breast cancer, and shortly after she lost her life to cancer. And my father was diagnosed with prostate cancer and is now a thriving prostate cancer survivor.
So is that what made you get the BRCA test? Because your great-grandmother, grandmother, and mother had breast cancer?
It was after losing my mother. It was finding out that my father was diagnosed. I was 21 at the time. I was in college. I was very fearful. I really felt that I was next. I felt that cancer was coming for me. That had me reach out to my doctor and update her on my family history. She knew about my mother's diagnosis, but she was not aware of my father's diagnosis. And our family history can change even annually, which is why it was so important to update her. And it was then we began to have conversations, and she talked to me about genetic counseling and genetic testing, and that the genetic testing would look for certain genes that would potentially identify if I was high risk for breast and ovarian cancer, as well as elevated risk for other cancers.
You felt like cancer was coming for you. And I want to go back to that fear because I know the world wants for us to go into this space of like, we're warriors, we got this, we have our capes on, but knowing that your great-grandmother had breast cancer, your grandmother had breast cancer, and your mom had breast cancer and lost her life to it, that's a lot of fear. So I just want to honor your strength in taking your life into your own hands. You had one person die, great-grandmother, then your grandmother, then your mom. Your formative years of your life were seeing women that you loved get the diagnosis and die. And that's a lot of trauma as well. And we don't discuss that a lot in our community. And that trauma impacts our choices to go and find the information that's vital to us getting diagnosed. For those who are watching right now who are saying, oh my God, my grandmother had breast cancer, my mom had breast cancer, my dad had breast cancer, please, comment, provide your feedback, because we all were in this together. You guys are a family. We're doing this show for you and for you to understand how to own your power, make the right choices that will save your life, that can save your life. So Ashley, having a great-grandmother who had cancer, then your grandmother, and then your mother dying from breast cancer, that's a whole generational level of trauma that you're looking at and you're facing. Yet you still had the chutzpah, the strength to go and pursue testing. So what did it feel like for you to feel those feelings of those you love and then having to go and take the test that would tell you whether you were at risk or not?
That's a great question. And there are 2 things that really sparked that fear and really fed that fear for a point in time. The first was seeing the women that I loved lose their life to this disease. I saw firsthand breast cancer try to strip my mother of her beauty, her dignity, and her strength, but she fought through. I also was fearful because of how my father was told that my mother was diagnosed. The medical professional at that time was very short with my father. He told my father, your wife has stage 4 metastatic breast cancer, and he said she has 6 months to live, and he walked off. And at the time I was 18 years old, I was at the hospital and I overheard that conversation. And I really believe that's what sparked the fear. It was in the delivery of how that information was shared and the reaction that I saw him have. I knew then something was not right. We knew what breast cancer was, but it wasn't a part of our family prior to her diagnosis. It was then too taking that fear and that experience, being very cautious and apprehensive as I began to explore my own journey, navigating my own risk for cancer. But luckily, I had a doctor who I had already had an established relationship with, and it was very easy to begin to have that conversation about my family history and about my risk. But it was those two things that really caused the fear. And even, I would say, here almost 14 years later, I had realized that I had been angry towards cancer for tearing my family apart. I had been angry towards cancer for having this almost paralyzing fear in my life for so many years.
Imagining myself or any 18-year-old child, your mother is sick, your dad is scared, your mother's the rock of the family, she's the rock of your life. And all you want to hear from your doctor who's supposed to protect you is that she's going to be okay. And if she's not going to be okay, tell you the news in a way that holds you in a space that is comforting and compassionate. Just thinking about you being in that hallway and watching and waiting to hear that news and hearing it that way, that hurts my heart. And no one should have to deal with that. When we talk about providers and how they talk about cancer, how they hold you in a space or not, if there's bias and how they treat human beings, whether you're, in your 50s or 20s or you're 18, this can shape and scar someone's whole life. And when you talk about people who are underserved or people of color and some of the things that, even people who are not, some things that shape our experiences to not go for testing or not go for treatments or in trials, or these doctors that would just tell you this news that can change your whole life and then just walk away. So I just want to hold you in a space of love, because I'm seeing 18-year-old Ashley in the hallway right now, and I wish I was there to hug you. That's a lot to deal with at 18 years old.
To him, she was just another patient. To us, she was a wife. She was a mom. She was the heart and the rock of our home, and she was going to be taken away from us. And it definitely could have, looking back, hindsight, looking back on it, it should have been handled better. It has an impact, a lasting impact on those that are around.
Yeah, and so I've been watching you for about a year and a half, and you remind me a lot of myself, like when I was in my journey and terrified and scared, things were falling apart. But I began talking about my story and sharing what I've been through. That's all we really have, right? Is our stories of what we've been through and what they did to us. So you took your story with your great-grandmother and your grandmother and your mom, and you became a patient advocate to help other people make better choices and be informed about their health history and deal with their fear of recurrences or their fear of knowing they could get cancer in the first place. And that's what I think is so powerful about your story. You didn't let your fear stop you. You've let your fear propel you even further to make a difference. Because now you're everywhere. I'm like, who's this girl? She's awesome. I got to know her. So I really admired that about you. And I want to just applaud you again for where you were and how you took that elephant and you said, you know what? I'm going to help women across the world to learn about their family history, to know about the breast cancer mutation, to get over the fear of recurrence and to live their best lives. So thank you for being that inspiration to all of us, to myself included. So once you got tested, your dad then got the BRCA test done, and he ended up having, I think you said, prostate cancer.
Yes, he had prostate cancer, and once he told me, that is what really sparked me questioning my own health. I had a lot of questions, and I knew I needed answers, and that's when I reached out to my doctor, and that's when I found out about genetic counseling and testing.
Right. So what did you do when you found out and your dad found out? What was the next step? Because now your mother had it, your entire matriarchal side had it. Then now your paternal side, but your dad did not have the BRCA mutation, right?
So we found out here recently, after over a decade, I had asked my father, would he consider undergoing genetic counseling and testing? He was very willing to undergo testing, but I realized I had to educate him on the importance of testing. And we both assumed that because of the multiple cases of breast cancer on my mother's side, that I inherited the mutation from her. But I did have to educate my father, and so it really took some time for him to grieve and heal himself, and for me to grieve and heal. My grieving was delayed after losing my mom, because I had to focus on my father and his prostate cancer journey, and then I had to begin to navigate my own health and risk management options. I really needed to give him that time to go through his own journey. I knew that was something I was going to ask of him, and I knew that he was willing, but it was just a matter of time. And so he did undergo genetic testing, where we found out that he was negative for the gene mutation, which confirmed that my mother was the carrier of the mutation, and I inherited my mutation from her. And let me tell you, that gave me so much closure. That gave me so much peace, if that even makes sense, because now I know who I received the mutation from. My mother doesn't have any living family members, but my father does, and if he had carried the mutation, then we would have definitely had to begin to have that conversation even more on his side of the family.
So what you did is, in essence, you took your fear and you walked into your fear, and you empowered your father to have a test that now has empowered you to be a better mother for your children, to educate them about how to be their own best advocate. Those of you who are watching this, what you just heard from Ashley was so powerful. She had really traumatic experiences around her family having cancer and lost her mother to cancer. But she learned how to be her best advocate, to be able to find out information that was timely enough to impact her life, empower her dad to get tested, and now to be able to help her children to be on the forefront of their own journey, to get tested ahead of time and see if they have a mutation or not. And so, if I know this is scary for those of you who are watching, what you can do is learn the facts early. Ashley's been so vulnerable in sharing her life with us, and I really thank you for that. But having a BRCA mutation and having the testing, you still have to be vigilant about your health. You can't say, well, I had the test, so I'm good, I won't be doing any more mammograms or testing. You have to still be vigilant about your monthly breast examinations, your annual examinations, I'm sure even your lifestyle, how you eat, exercising. So tell me how you do all that and still self-advocate.
I had to own my fear. I had to really validate my feelings and understand that it was okay to feel the way that I was feeling. My feelings were real. But then I also know where my help comes from, and that is my faith. And I realized that fear and faith can't coexist. And so I chose faith. And it was through that faith that I began to be proactive about my health. And I began seeing a high-risk oncologist to monitor my breast and ovarian health. Now, mind you, along the way, I was still fearful with every milestone that came during my journey, but I still focused on my faith. And so I began seeing a high-risk oncologist, and that's where we discussed all of my risk management options. We discussed increased surveillance, which would aggressively monitor my breast and ovarian health. We discussed hormone therapy, which would reduce my risk, and we also discussed prophylactic procedures. And at the time, I was 21 years old, and so I had to make the choice that was best for me. And at the time, at the age of 21, I chose increased surveillance. And I did that for about a decade. And within those 10 years, I met my husband, and we got married, and we had a baby. And it was during that time I realized that I needed to reassess my risk management options because my lifestyle at the time, it was very challenging to go to the doctor as frequently as I needed to monitor my breast and ovarian health. Because during those times, I was getting mammograms, ultrasounds, and MRIs and transvaginals to monitor my breast ovarian health. So I was in and out of the doctor's office very frequently, but I was empowered by my decision because it was the best decision for me at that time. And so after having my first baby and breastfeeding her, I talked with my husband, I prayed with my husband, I talked with my doctor to explore other options. And that's when I decided to have a bilateral prophylactic or a double preventative mastectomy to drastically reduce my risk of breast cancer. And that brought on a whole nother level of fear.
You said fear and faith cannot coexist. And it's easier said than done, but you have to work on that faith, right? You have to think about your spirituality as you move into the space of science and what to do next. And so, first of all, I want to just hold a space for that. For those of you who are afraid or worrying about recurrence or have mutation and don't know what to do, just hold your heart and think about the fact that fear and faith cannot coexist.
They can't.
Thank you for that. They can't. That was so powerful. And then, so you were all soulful, then you were like, listen, I got a high-risk doctor. Okay, so you're all like in your heart space and you're like, okay, you got to get to the business of science and taking care of myself. Some people don't know that there are high-risk doctors they can go to if they have the mutation. I mean, I didn't know for a long time that there were doctors whose core work was taking care of high-risk patients, and some focus on people who are high-risk patients of color. And so if you know somebody who has a BRCA mutation or thinks that they're high risk, you can ask your doctor for a high risk provider to give you guidance on how to navigate your life being a person that has a high risk of breast cancer. Then you mentioned that you met the love of your life, and he's now brought some new hope and joy into your life, and you have the one baby, and then you made a choice that was going to be life-saving for you, which is to have that prophylactic mastectomy before your next child, right? So tell me about that decision-making process when you made that choice of like, okay, my great-grandmother is in my mind. My grandmother's, had her diagnosis. My mom is gone. I now have one beautiful child and a husband I love, and I want to have more children. And what are the feelings you felt going into that place of like, I'm going to go into this room and lay on this bed and I'm going to get up without breasts?
It was a whole nother level of fear because now I had transitioned from 10 years of increased surveillance to now a prophylactic or preventative procedure. And I began to question my faith, if I was having faith in God, if I was believing in Him. It was literally 2 days before surgery, and I was sitting outside the hospital for a pre-op, and I was crying, and I questioned if I was making the right choice. And I called my best friend, and we went through just the facts. And the facts were I had a family history of breast cancer. The facts were I had 2 parents with cancer. I was BRCA2 positive. And so really level setting helped me to ensure myself and support myself of saying I was making the right decision. And so I did continue on with the procedure. But then I also had that emotional and mental uncertainty of the outcomes of this procedure. But that's where I had to lean on my faith.
You're a young mother, you're beautiful, you have the husband, and I don't care what anyone says, you're gonna think about, what would this look like with me going home and taking off my shirt? So I remember when I was going to have my surgery, I got up that morning, I took a shower, and I just looked in the mirror, I was naked, and I was like, this is my body. This is my body I've had for all these years. And first of all, I didn't really appreciate what it was doing for me, how hard it worked for me. Now it has cancer, but also I thought this could all change, in a matter of hours. So I looked in the mirror that day and I just stood there. I'm like, this is me. This is what cancer looks like. I look the same like you do. You're beautiful. You're vibrant. Your skin's glowing. I'm like, how is this happening that I'm making this choice right now that would change my life in the next few hours?
And it changes that quick. It literally changes in a matter of hours. And you have this new body. You have these new scars. I was an A cup, so now I'm waking up to having my breasts removed. And then knowing that I'm going to have reconstruction and uncertain of what that looked like. But what's in front of me is my breasts are gone. And I question my womanhood. I questioned my self-image. I questioned if my husband thought I was attractive. All of those things run through your mind.
So, my next question is about that fear and all of that was inside of you, but it didn't stop you from doing the right thing for yourself, for your daughters, and for your, at some point, granddaughters and great granddaughters, so they have better options and better outcomes, perhaps. But what you had to do was really talk to your healthcare team. You had to pursue finding the high risk doctor. You had to ask the right questions. How did you learn to advocate with your doctor, to ask the right questions and get to the point that you're now a patient advocate who's speaking, you're on Zooms, you're on TV stuff, you're doing all these things to empower women? And it's not that you were taught, you were self-taught how to be an advocate. Can you share what that was like and what people could do to better advocate with their providers?
Absolutely. So first, it was resources, the Tigerlily Foundation.
Aww.
And it was organizations like the Tigerlily Foundation, Force, and others that really educated me on what it means to carry this mutation and this risk. The second, it was asking the right questions. Talking with people who had traveled similar journeys, learning from their experience. And the one question for me that was the most powerful was, I always asked, was this medically necessary? That question helped me to navigate through my journey. It was also using my voice. It was also being comfortable with pushing back or asking additional questions or speaking up when there was an option or a decision that I wasn't fully comfortable with, because I knew that I had to be my own self-advocate. When it came time for reconstruction, I'll give you an example. As a woman who has accepted myself having a certain size breast to now having to receive implants, I was very concerned in making sure that I looked very natural and comfortable for my body. And so it was asking the doctor what was medically necessary, what were my options, and having those touch points. I would say it was those three things. It's reaching out to organizations that are doing great work in this space. I would say it's asking the right questions, and I would say it's using your voice to speak up, because it's your body and it's your life, and your voice is very powerful.
That's so important. It's your body and it's your life, and your voice is powerful, and you're using it very well. You're so amazing in so many ways. You are. I'm so proud of you. I'm sure your mom's watching right now. She's with us, and I want to hold a space for your mom, because I know that as a mom, when you're going through the journey, I always said if I didn't make it, my daughter would never be alone. I'd always be with her. So I know she's with you right now. She's so proud of you for being who you are, being such an amazing soul, and for being look what you're doing. You're sharing your story with the world now in a big way. So just want to feel that right now, and just honor your mom and your grandmother and great grand as well, and your dad,
Absolutely.
and your husband for being there for you. That's beautiful. Tell us about the screening process. So even though you have not had breast cancer, you are a previvor, which is you're still at risk. For those who don't know, when you're a previvor, you haven't had cancer yet, but you have the BRCA mutation, so you are at risk for breast cancer, which means constant vigilance and screening. This is an important topic, and we are here for you. You're part of our family, so don't think twice about asking questions, challenging me, and we're here to help you live your best life, live a long life, and have a better quality of life. So Ashley, preach about your screening journey. What do you do every year to ensure that you're on top of your health?
Absolutely. And first, I have to say, on the other side of genetic counseling and testing is empowerment, full-blown empowerment, because now that I've had a prophylactic mastectomy, I still see my surgical oncologist annually for clinical exams. I still complete my monthly breast self-exams. Now that I'm done having children, I now see a high-risk gynecologist, and with those screenings, I still receive my transvaginal ultrasounds, and now I receive a CA-125 blood screening. And so I do this every 6 months to continue to monitor my ovarian health. It's so important to know that even though I've had this mastectomy, I still have a low risk of breast cancer. The average woman has about a 12 to 13% risk over her lifetime. And someone who's BRCA2 positive has an increased risk. And then after you have that double mastectomy, your risk does lower, but a risk is still there, which is why I still do those self-breast exams and clinical exams. In addition to that, I've made lifestyle changes with my nutrition. I still work out and lift weights. I've also learned to spin because, you know, when you do have a mastectomy, you lose a lot of your strength and your abilities in your upper body. And so I've had to modify my weightlifting workouts, but I've also learned to spin, as well as doing other exercises. In addition to that, it's also taking care of my mental and emotional health as well.
Yeah, no, I think that's one of the things that came for me out of my breast cancer journey is like loving myself. You know, just people say that they love themselves, but it's really about like, what is your holistic plan to love your body? Because I go back to what I said before. I was looking in the mirror before surgery and I'm like, this body has carried me through so much in my lifetime. And I didn't realize all the things that work in concert to keep me here. And so I said, when I'm done with this whole thing right now, like this whole surgery stuff and chemotherapy, I'm going to love on myself. And so that really involves, to your point, like the mental health aspect, the emotional aspect, you know, who's in your space, friends who empower you, friends who tell you it's okay to be scared, but go forward anyway. And so like, I'm all about like energy, prayers, meditation, like this whole set is all my energy. Like, I'm like, I want it to be like a whole Maimah energy space because it's really about, you know, embracing yourself and loving all parts of yourself, even your scars. After my surgery, they cut my nipple off and went inside and got the tumor. And I had incisions, you know, on both sides. I wouldn't wear, you know, tank tops for a while. And I didn't want to see myself naked because the scars took a while to fade. But I really learned over time that those scars were like my stars. Like I survived this thing, right? My body was there for me and came for me. It's like cancer, I'm gonna come for you. And it protected me and I got through the journey. So I was gonna honor it with giving it time and attention and rest. And even when it, you know, hurts sometimes, I say thank you body, thank you God, thank you pain. I have to love that pain even deeper. Thank you, teacher.
You said something, you said your swimsuit. It took me 3 years to wear a swimsuit. I was so self-conscious for a couple of reasons because I was wondering were my scars going to be visible. And then I didn't have any feeling in my chest. And so I was hoping that nothing would pop out or poke out.
I've had friends at events where we're at an event and somebody has like a missing testicle. Somebody has like, oh, I had a brain tumor here. People are pulling out their bra, their implants and throwing them in the air. It's like, it's a freaking circus, but we're loving that we're here, you know? And
exactly.
One of my really good friends, her mom went to the beach one summer and I had on a beautiful like brown bathing suit and I had a wrap on and she's like, excuse me, girl, take that off right now. We're doing a photo shoot. And I was like, no, I have scars. She's like, what scars? She didn't see my scars. Only I saw my scars. She saw somebody who had overcome tremendous challenges, who was a mother. What I see when I see you is beauty. I see strength. I see transformation. I see that you are educating me, you know, and people who are watching to face their fears and despite the challenges, walk through them anyway. So that's pretty amazing. We talk about generational health a lot, you know, within Tigerlily. Growing up in West Africa, people would die and nobody would tell us what they died from. It's like cousin so-and-so died, you know, this person had they had witchcraft, or this person just died and they're just gone. You weren't at the funeral, you didn't know what happened. And so what I think was so empowering for you is knowing your family health history, and that helped to inform you making the right choices for yourself. So just share with the guests who are listening and watching how important it is to know your family health history, because that can inform your life's plan, your testing plan, your high risk monitoring plan, and perhaps inform your life, right?
You're absolutely right. There's a saying, you know, what happens in this home stays in this home. And with certain things that is true, but with our family health and our family health history, those things need to be shared because that is knowledge for the next generation. You know, losing my mother was the defining moment in my life, and genetic testing was the pivotal moment in my life because it changed the trajectory of the impact of this disease from my past to my present. And when you look at your family history, and I look at my family history, breast cancer aggressively attacked 3 generations of women in my family. And through knowing my family history and genetic testing, me and my daughters can aggressively attack breast cancer preemptively and aggressively.
Wow. Like that is like, it's like, that's so huge, right? Like I want people who are again watching to really hear that. That is so amazingly powerful. It attacked your family, great grandmother, grandmother, and mom, and it turned you into a warrior for yourself and your family, and that's really huge. What are the positive outcomes that come out of addressing and dealing with fear head on? For one, you said it totally empowered you. It changed the trajectory of your life and your daughter's life. But what are things that you can tell the guests who are watching that are positive outcomes of addressing their fear head on?
Definitely, when you face your fear head on, your strength is revealed even more. Especially as I became a mom, the fear was for my daughters. And as you said, I went into that warrior mode to where not only did I have to protect my health, but I had to protect my daughter's health and their standard of care going forward. Through that fear, I've persevered. I always say I've been gracefully broken, but I've been rebuilt with strength.
That's so beautiful. What you're saying is people always think that things cannot, in a sense, coexist, but they don't negate the other one, right? You can be graceful as you're broken and you grow through that grace. Like it's like watching, like when you break a glass, right? The light reflects off the glass in its beautiful little prisms. And when you put it together again, it's not perfect, but it's always beautiful because that prism now is reflecting all these different like parts of the broken glass in a sense.
You know, to your point, you realize that, you know, fear is real, but it does not have control over you if you allow it to. You have to choose faith. You have to choose perseverance, and it looks different for all of us. It takes family support, it takes community support, it takes our support from our various houses of faith, and it takes support from organizations like Tigerlily and others to help to build that perseverance and that strength and that empowerment to know that you as a person, you are the expert of your own body and that you don't have to do it alone.
You know, you found the right doctor, you begin seeing a high-risk doctor, you did all these things. So you put together your own plan. How did you put together a plan? Because people don't know what to do. I know I didn't know what to do. I was just like frozen in fear. And my girlfriend came from California to kind of help me because I couldn't think straight when I was diagnosed. So having a treatment plan that's solid and being educated as much as possible is one of the best things you can do to navigate as a pre-survivor or a survivor. What are things that have worked for you, and how can you advise those who are watching this to find a way to put that plan in place that helps them to have better outcomes?
So I think what was important was knowing all of my options and exploring all of those options. It was identifying where I was at that moment in time in my life. It was identifying circumstances. It was identifying barriers. It was identifying challenges. And it was taking all of those things into account and making an informed health decision. And a part of my decision was at the time when I decided surveillance, I was not married, so it was my choice. When I decided to have a preventative mastectomy, I was a married woman at the time, and I believe, yes, it's still my choice, but now my husband has to be a part of that choice because his thoughts and his perspectives were very important. And I was so very fortunate and blessed that he was very supportive and he understood my decisions and my why. Knowing all of your options, knowing where you are in your life and in your circumstance, but then also understanding that you might have to be flexible with yourself. But it's also important to voice those concerns and challenges with your medical team so it can help guide a more stronger medical plan. And then too, always learning. Now that I had my preventative mastectomy, I'm now focusing on my ovarian health even more. And so I'm educating myself on different studies and clinical trials and procedures for when I make that decision to manage my ovarian health even more closely. And so I think it's important to involve those that you love, but knowing that it is your choice. It's important to do research. It's important to ask questions, and then also always being flexible with yourself and with life.
Beautiful. So one last question for you. What's your mother's name?
My mother's name is, I'll say, Dr. Lynn Armstrong. And I have to put that doctor on there because first she earned it, but she earned it while she was battling breast cancer. And I'm so fiercely just happy and excited that she did not give up. And I'm so proud of her. So Dr. Lynn Armstrong.
So she's with us, I'm sure, right now, watching you and smiling with you, with us in this room. What do you want to say to your mom right now, to Dr. Lynn Armstrong in this moment?
So I want to thank her because I believe and I know that if she knew that she had to sacrifice her life so that I could live, so that her grandbabies, her granddaughters could live, I know that she would do it all over again. She battled this disease with fear, with doubt, with challenges, but she also handled it with grace. She handled it with her faith, and that is what drives me today. And so I just want to say thank you. You fought your fight, you kept your faith, and I know that you are in paradise.
Thank you.
Thank you. Thank you for allowing me to talk to her. I don't think I'd ever done that.
Thank you for trusting me. I love you.
I love you. Thank you so much. Thank you for all that you stand for. Thank you for your platform, for educating all women. Thank you for your fight for inclusion and acceptance of all women. Thank you for everything that you're doing.
I just want to serve. I want to make sure that as a mom, you know, one of the things when I was laying in bed and not knowing, having triple negative breast cancer, what would happen to me, my daughter was 3 years old and I couldn't imagine leaving her alone. And I made a commitment that I would do everything I could in my power to ensure that other women who lost their mothers or daughters had support and love, and that I would fight with my last breath to ensure that others didn't lose their mothers and daughters. And those who did, I would hold them in my arms and I would love them like I do you. So, and I promise you that I will hold your hand, be with you, and we'll honor Dr. Armstrong in all that we do. And this work is a lot of work, but it's just, we have to do it together and lift each other up, you know? So I just felt sitting with you here, I just felt this energy around me. It just felt like it's just, you know, like something, and I can see your mom just smiling with you and smiling through you. So thank you for this sacred moment to share her love with us. And thank you for allowing God to speak through you for those who are watching who are living in fear and don't have the conversations that we should be having. I just thank God for this time with you today. God bless you.
Thank you. Can I share one last thing? So the day of my surgery, I told you I was in so much, you know, just uncertainty. I was very fearful. And I'll never forget, I was going in waiting for the anesthesiologist to come in. And my doctor had already came in and he said, your nurse will be in shortly and she'll be your nurse through your departure or when you check out. And my nurse walked in and I saw her name tag and she said, hi, Ashley, I'm Nurse Lynn and I'll be taking care of you today. And so I knew at that moment, all my doubt, all my fear, everything just left because I knew my mom was there and she was my angel and she was my nurse. When you brought up what I would say to my mom, I would also say thank you for being there that day.
I don't have anything else to say. I'm speechless. Thank you so much. And thank you, Dr. Lynn. Love you. To everyone who's watching right now, I know that you just heard Ashley's powerful story, and you didn't just hear her story, you felt her story, because I'm feeling what it must be like to hear that your mom has cancer that's terminal at 18. I'm feeling what it's like to have your dad have cancer. I'm feeling what it's like to know that you have a mutation that could alter your life in your future, and make a choice that to remove your breast to save your life and to be there for your children and not be able to breastfeed your other child. I'm feeling what it's like to go home to your husband and wondering if he's going to want you with no breast. And I'm feeling the loss of a mother. As a mother, the thing that we struggle with the most is not being there for our children. And every person I talk to who has lost their mom, I feel their pain, because I too have a daughter that I live for, and I spend my entire life working to ensure that I am here for her and that I fight for her and that she will never get this disease. And so I want to thank Ashley for sharing her story, and I behoove all of you watching this to talk to your daughter about breast cancer. Talk to those who you love who may have had the disease and don't talk about it enough. Know your family health history. Ask the questions, get the testing, see a high-risk doctor, and just take care of yourself, because you only have this one life. It's all you have, and you have to own it, be responsible for it, keep it sacred, care for it, and care for yourself. If you have any questions, please comment, please share, tag somebody you love, and we'll see you next time. Thank you.